UnitedHealthcare recently published results from its 2020 Wellness Checkup Survey.
And that survey looks into people's opinions about health topics and preferences to help provide insights to improve well-being and disease management programs that are offered by employers.
Dr. Robert Kantor, the Chief Medical Officer of Minnesota at UnitedHealthcare, joins us now to talk about some of these wellness trends. Dr. Kantor, nice to have you with us.
Good morning, and thanks for having me this morning, Jason and Heather.
You guys asked people kind of during this pandemic what they were doing for exercise, and you found walking by a large margin number one, right?
Yes, walking was, and of course, running was second.
And that's is
not
that
a surprise.
Yeah, not a real surprise, right? I mean, these are low cost of entry, kind of easy things for people to do.
Absolutely.
Doctor, let's talk about nutrition, because you asked people about nutrition. We know for some people, now that we're into this a little while, they're getting back to normal. But for some folks, their eating really took a dive in terms of healthy eating habits.
Yes, that there's some stress there, and there might be some stress eating, as well as access to snacks.
All right, I want to talk about some of the things we're looking forward at, because you asked people if they plan on getting their regular flu shot, because I think there is some concern that, people are hesitant to go into doctor's offices. What did you find when it comes to the flu shot?
Well, about 30% are more likely to get that annual flu shot, which is a good sign.
And what does that tell you, though? Are you having a good sense that people will be going in and getting that flu shot? Because we've just heard from the CDC today that this could be a terrible fall.
Well, I think there's an incentive. People are thinking about this more than ever before. And I think what we're seeing also is that by taking these steps to be careful about your health, getting shots and such, you're going to stay away from exposures that could be at risk, and you're not going to need to see docs or go out in the community to seek care. So I think there's positive changes as well.
What are you hearing from people when you ask about going back to the workplace? Are people looking to modify their habits there?
It's a mixture. Half of the people are ready to go back to work when it's appropriate, but they're going to change their norms of behavior. They're probably not going to shake hands, some of them. Some of them are finding other ways to do that, a little fist pump or elbow bump. And some will do the same as usual, but it's a mixture.
Doctor, part of the reason you do this survey is to help programs and employers with their wellness programs. What are you hearing from employers? Are these wellness programs evolving? Are they getting better as we are going through this COVID pandemic?
It's great that you bring that up. For those that have benefits, the people that are able to access those are very happy with them. About 77% of them have found some kind of positive health benefit from it. Those that have it are likely to improve and increase those benefits. And those that don't have benefits through their employer would be very interested in having them. About 71% would be interested in looking into them.
Dr. Robert Kantor, the Chief Medical Officer of Minnesota at UnitedHealthcare. Dr. Kantor, thanks for being with us.
Have a great rest of your week. Thanks so much.